No medicine can remove the cause of a lifestyle disease, but you can. Welcome back to Lifestyle Disease Doctor. In this third episode of the 4-part series, we look at liver disease and fatty liver disease and the comorbidities and complications associated with them. Also, we see how lifestyle correction plays a major role in treatment of these diseases. With us today, we have Dr. Jolly Thomson, whose extensive experience in treating lifestyle diseases, chronic lifestyle diseases, focused on reducing medication and avoiding surgery, will be able to give us a better picture on the treatments available for the comorbidities, that is, associated diseases and complications of liver disease and fatty liver. To begin with, one of the aspects that we went through in the previous episode was that if a person has multiple diseases and the liver has a problem, you were mentioning that the treatment, that is the conventional treatment with medications, becomes more complicated just because the liver is compromised. What you mentioned was that if the liver was compromised, the medications would not function well. So that creates a big problem. So to begin with, we also would like to know what are the general comorbidities that are associated with liver disease and fatty liver.
Most common problems, that is the most common diseases itself, lifestyle diseases. It is none of these lifestyle diseases stand alone. They'll be coming as a group, one after another. So the fatty liver patient or the person fatty liver, it will be progressed to stage 1, stage 2 or cirrhosis or the renal liver failure. There'll be definitely other problems also, like initial stage there will be obesity, but when the liver failure, on the end stage the patient will be thin and emaciated and all. And there will be the initial stage there will be usually diabetes, hypertension will be there, diabetes will be there, and this atherosclerosis and the dyslipidemia and atherosclerosis and the blocked vessels like coronary artery block and heart disease, and it's all going together actually. So they will be taking medication if it is has progressed to stage 3 or 4, definitely they have been taking medication for a long time. So actually when you are taking medication, it is actually these medications will be definitely straining the liver, and the progression to the stage 1 to 2 and 2 to 3, and even going for the failure or going into the cancer, definitely this if it is hepatitis is progressing, that is is non-alcoholic or alcoholic steatohepatitis, that means if the liver enzyme is also high, so definitely the chance of cancer also is there. So it all will be progressing along with the this medication also. So what we had to understand, that we had to these diseases are not came because of the lack of medication. So we had to understand that it is only you are following a wrong lifestyle. That is, lifestyle means eating habits and also your activity habits, or you're taking too much of toxins like color, preservatives. We are all tastemakers. We are all very attached to taste, especially with this modern food. So much of tastemakers is added. We are giving importance for the taste actually. For that, we are compromising intake of toxins, which is not needed for our body, and also we are compromising nutrition also. The nutritious food, leafy vegetables, the fresh vegetables and all will not be tasty. So we will not be avoiding that, and we are taking processed food, especially the food made of processed powders and like maida and all. So it is devoid of any much of the nutrition, only calories there. You are adding maida with sugar and salt and hydrogenated fat and baking it and making it very tasty, and adding some tastemakers, color, preservatives, etc., and make it very attractive pastry, cake, and all these bakery items. So these are actually harming us, that we have to understand.
Actually, when we talk about these comorbidities, they say that diabetes creates high blood sugar, then cholesterol, high fats, then hypertension, pressure, high pressure. So they say that all these three directly affect the liver. So if a patient is suffering from these related diseases, and then those diseases are directly affecting the liver, what should the patient understand?
These diseases actually not only affecting liver, the sugar is going everywhere through the blood vessels. The whole blood vessels is getting damaged. The hypertension, this high glucose, it is damaging the blood vessels and all the cells in our body. And also the hypertension, the pressure is increasing. Why? The blood vessel is getting narrower and the heart has to pump high. So that is also the blood pressure. High blood pressure is an indication of the this blood vessel damage actually. So high triglyceride and actually the cholesterol is not that important actually. According to the latest understanding, it is not the cholesterol is the major harm. Actually, the triglyceride has to be corrected. If the triglyceride is kept low, then the slight increase in the cholesterol or is not that harmful for the body. We have to keep the triglyceride normal without any medication. That is the most important. So if the triglyceride is normal, this accumulated fat inside the blood vessels, actually the fat is accumulating inside the blood vessels, that is actually narrowing the blood vessels and creating high BP. So this excess fat will be taken off, absorbed. So that is the beauty of our body. It can even the blood vessels can repair by itself, and the liver, even it is fibrosed, the hepatocytes can multiply and regrow, and we can compensate for within. Actually, the lifespan of the liver cells is almost 1.5 years. If you are we came to stage 3 or stage 4 fibrosis and cirrhosis also. If you correct your lifestyle and take your correct nutrition, give a chance for the liver to repair. It may take 1.5 years for the full repair. But I am saying that in the cognitive supported lifestyle correction, every 3 months we repeat the ultrasound scan and see it is very fast progress. I remember one person was in the stage 4 fibrosis. Actually, in the initial stage, he had fibrosis and fatty liver. The liver was enlarged. And in the third month, 90 days scan, actually his liver size is reduced. So he was worrying, which is any problem actually. So whether it is actually in the that is because of the fat content is reducing, the liver size will reduce. Then in the 180 days scan, it has come to normal. And the fibrosis level is also, now the fibro scan also is there. And not only the liver size and the regular abdominal ultrasound scan, the fibro scan shows showing that the fibrosis level is reducing. Fibrosis level is reducing means there is more and more new hepatocytes are coming up. So within, by the time it was almost, this fibrosis stage was reduced. Fibrosis part was reducing. Fibroscan was many of the parts it was normal, and the clear improvement was there. Actually, within a year, if he's following the diet and the instructions, the liver will regrow to normal within 1.5 years. That is depends on the regeneration and the dividing capacity of the cells.
I've heard you speak about this polypharmacy as one of the major issues that is affecting liver health. So only now patients are also getting a picture about polypharmacy and all that. So what is your message on this polypharmacy? Because we are talking about these multiple disorders at the same time, polypharmacy and its effect on liver health.
Liver disease patients, there will be other diseases, definitely diabetes, hypertension, dyslipidemia, heart disease. That is the most common prescription I'm seeing. And other things, the psychiatric medicines definitely increase the weight gain, and also fatty liver will be very common. And many of the patients who are taking antipsychotic medicines will be having given statin also, because they will be having this fatty problem is there. And many patients will be this arthritis, this degenerative disease of the knee or the disc prolapse patients also will be having this excess fat, and the other problems will be there. They'll be taking painkillers, and even these rheumatism patients, they'll be taking steroids and so many medications. Methotrexate, it is a very liver toxic medicine, methotrexate. So the patients will be, see, in the modern medicine, what we are actually treating is, we are basically focusing on the symptom relief, not the root cause. Root cause, if it is an infection, we are concentrating on the root cause, like killing the germs using antibiotic, antiviral, antifungal, etc. And also we are using these vaccines for the immune strengthening. But these lifestyle diseases are of inflammatory nature. So what we are doing is suppressing. And say actually almost all the medicines we are using is to anti-inflammatory, reducing the inflammation. But the problem is in our immunity. Actually, everything in our body is controlled by the immune system. There is this inflammation is there that is attacking. So inflammation is coming in the diabetes. Diabetes is considered as an inflammatory disease. Inflammation is coming from where? Actually, this toxin. Toxin is glucose, our own food, the rice we are eating, or the wheat we are eating, or the sugar we are taking is becoming a toxin. And that is actually creating inflammation. That is why the diabetes is called an inflammatory disease. So when we are taking anti-inflammatory medicine, when we are taking pain, actually this aspirin we are taking, it's also an anti-inflammatory. The natural tendency of the blood is to, if there is a wound, it has to clot and prevent bleeding. So what we are doing is inflammation is high, so the blood has a tendency to clot. Inflammation, too much of that is why in the COVID situation there is pulmonary, this lung vessels, the blood was getting clotted because of the high inflammatory level. Blood clotting has increased. And actually this because of the high inflammation, the clotting is increasing. That is the reason for this, and sometimes the attack also, heart attack and the stroke and all. So this when we are taking anti-inflammatory medicine, we are actually blocking the healing aspect also. That is why in our clinically supported lifestyle correction, if you want the body to repair by itself, the anti-inflammatory part also should be strong. To make the anti-inflammatory part strong, inflammation and anti-inflammation is controlled by this omega-3 and omega-6. Everyone knows that the omega-3 is good for health. So for the heart disease and this rheumatism and all, the people are started taking omega-3 supplements and all. See, omega-3 is actually the anti-inflammatory or healing part. The omega-6 is the inflammatory defense part. Actually, all the medications we are using, a major part at least, is actually suppressing this inflammation. But all the medicines which is suppressing the inflammation, because it's a parallel pathway, it is suppressing the healing process also. So it is very important if your body has to heal, to avoiding medication or tapering off the medication with the lifestyle correction. You cannot taper off medication just like that. With the lifestyle correction, you can gradually taper off all the medication so that you can this healing aspect can be promoted, that immune system can be in balance, and you can get a healing. And for even the liver problems, you get the healing is happening in that way.
Actually, with your extensive experience in treating lifestyle disease patients, can you give an example of how this sort of thing actually worked out when a patient came with liver disease and also multiple other disorders?
Almost 90% of the patients, they are coming, maybe 95%, they'll be having at least stage 1 fatty liver will be there. And many, if you are reached in the stage 2, there'll be this liver function test also will be high. Like this SGOT, SGPT and all will be high. So I have not treated the claim for the patient who are coming for the clinically supported lifestyle correction will be having, at least when we are looking into the blood report, it will be many abnormalities will be there. And one of it is there can be kidney problems can be there. In this thyroid problem, this Hashimoto's thyroiditis is very common. In the ladies part, the PCOD and menstrual irregularity will be there. And of course, diabetes, hypertension, dyslipidemia is the most common. So they will be taking at least 2-3 problems will be there. Not just for, I have not seen anyone with just for this liver problem alone. Very rarely the liver problem alone is, it's definitely there will be other problems also. I don't remember any patient will have only the liver problem. So when we look, at least the overweight will be there, this excess fat will be there, and many other parameters will be also abnormal. And inflammatory and this autoimmune factors, this autoimmune hepatitis also is there. But there are 2 types of autoimmune hepatitis is there. One is fast progressing, but I don't get into that. No one will with the fast progressing liver disease. I cannot, the clinically supported lifestyle correction, we are usually managing the chronic problems. Chronic, this hepatitis which is those who they are not overweight, not alcoholic. Those patients, if you are getting, and even not diabetic, not hypertensive, those who are patients, if you are getting liver disease or the fibrosis, which is going into fibrosis and all, it can be of autoimmune nature. All this can be actually even the autoimmune nature problems, and it will be definitely most of what I have understood from my experience, may not be in the medical literature. What I understand is it is related to gut and the food we eat. Many food we eat, which is very common, like the pulses like this Bengal gram, which is very common in used food in India. It is intolerant for many. It is allergic actually. There is I think around 15% of the people, and some studies also, this this dal chana or the Bengal gram is not tolerant for many, because many of these food items in our routine cuisines, it is that is a major part. And even many vegetables and fruits, which is evidently healthy food, also may not be good for the person. Now we have methods, the diagnostic methods there to find out which food is reacting to you, and which is at least partially, not everything we can find out from the test, but we can. And if we are correcting that, this usually in this autoimmune disease, some of the autoimmune markers will be positive. Even the autoimmune markers will come down. The fatty liver and the hepatitis, this SGOT and SGPT will come down within few weeks itself actually. Along with this weight reduction and the cholesterol and the triglyceride reduction in the blood, this SGPT and SGOT within 2 or 3 weeks, most of the patients, if they are following it correctly, the obese person, whether the person is following it correctly, dependent on the weight reduction also. So everything will be correct and proportionate reduction will be there. And the hepatitis part, this high liver enzymes and all can be reduced very fast. And usually what all medications are taken, and most of them will be, if there are, I have seen patients with liver disease taking 20-30 tablets a day, for 2 or 3 for the diabetes, 2 or 3 for the hypertension, cholesterol, and some statin and also blood thinners, and for some bile salt supplements and many other medications. Maybe they'll be having some psychiatric problems, anxiety, and they'll be taking for that also. And if the patient is following correctly, within a month we can come out of most of the medication at least. And that itself is a relief for the liver. And we had to come out of medication, then only we can give a chance for the liver to give an optimal situation for the liver cells to regenerate. So that is possible actually. There may not be much of the literature in the medical world like this, because no one is talking in the modern medicine about the lifestyle correction much, or there's not much studies about this lifestyle, how lifestyle correction is benefited. We are studying only about the this drug studies will be there, and also the effectiveness of the drug will be studied, and also effectiveness of even the surgery. There is not much of the study actually. Only the studies are concentrating on the medications or the drugs. We are not correcting how much benefit is giving. It is not there. That is our deficiency actually.
Actually, from what we heard, the liver plays a major the liver plays a major part in actually handling the okay. Actually, we understand that the liver plays a major part in handling the medications that are given to a patient. At the same time, if you look at liver health, if the liver's health is compromised or poor, then giving medications is actually adding to the risk and all that. So sometimes we also find that many patients who are having liver issues, they have some problems with their mental health also, cognitive decline and all that. So what is it that actually causes that, and what can be actually done about that?
See, cognitive decline will be severe in the end stage, because the patient will not be able to understand what is actually the end stage of the liver disease. The patient can go into coma, and because this toxins is accumulating, and because the liver is not able to function and the toxin is accumulating, and it is giving damage to the nervous system. That is the reason for the end stage cognitive, and even the patient will be present as a psychiatric patient. because they don't know what is, they cannot recognize even the basic cognitive function will not be there in the end stage. But in the early stage, what is happening is many of the necessary things for the brain functioning also, and even the hormones and many things is actually just the production unit of the body. Almost 500 items are produced by the liver. Even this glucose, the food what we are eating, actually it is processed. The processing of the food we are eating is happening. Food we are eating, it is absorbed into the system and going directly into the liver. The glucose, it has to be processed, and if the excess is there, it will be converted into glycogen for immediate use, and for the long-term use, it is converted into fat, and it has to be taken to the adipose cells, and such things are happening actually. Even the vitamins, minerals, actually the liver, we all take this, when we take into the very good source of vitamin B, vitamins, any of the vitamins, when we take it's actually the liver, vitamin D, the best source of liver, this animal liver is used as a nutrient, the special food for us, for many of the diseases. Even we know that cod liver oil, this one special fish liver oil is taken as the vitamin, this omega-3 supplement. So liver is the the liver, most of the vitamins are concentrated in the liver. So that is why liver is taken as a healthy food for the animal. Liver is taken as a healthy food actually. So when we are eating, everything is going and concentrating in the liver, and the liver is producing and distributing. This is the kitchen. Actually, the body's kitchen is the liver, and not only the kitchen, it is the excretory organ also. So the production unit and the excretory unit. So when this liver is not producing, then we had to all the brain functions, cognitive function will be reduced, and also along with that, liver has to produce the cholesterol. Cholesterol is very essential for the cognitive function, and the cell multiplication. Cholesterol is needed. If you are taking, if you have liver disease and you are taking statin, then how the brain will get enough cholesterol? How the body can repair by itself? Then repair of the body means the damaged cell has to be replaced by the new cells. For that, the cell membrane is needed. So the body building, this cholesterol has an important role. So if you are the liver is sick, liver is the one who is making the cholesterol, and it is sick and it is not able to do its function, and you are the basic production capacity also reduced by giving statin and blocking the production. The enzyme, which is the crucial enzyme in the production of the cholesterol, is blocked. So how can you expect a good intelligence and cognitive function in that situation?
You often say that this liver and the gut health are very much connected, and so that they have to be taken together. So if you have a weak liver or compromised liver, the gut also will be compromised, and vice versa. So what is actually the way we can see both of these together?
The gut health and liver health, I can explain in an easier for the understanding way, this connection between the inflammatory bowel disease. Inflammatory bowel disease, like this Crohn's disease or colitis, what is happening? Actually, there is ulcers inside the bowel. So, or even in this gastric ulcers also is because of this, the ulceration will be there. And what is happening during the ulceration and how it is liver is connected? If there is an ulcer, that means the undigested food or the bacteria inside this microbes inside the intestine can get into the bloodstream. This bacteria or viruses or what all things or undigested food, absorbed digested food is there, and undigested food and toxins also get in this. So even not only bacteria, there is endotoxins which is secreted by these bacteria and all this. Even there are worms will be there. They are all secreting so many things that also get into through this open blood vessels. The ulcer means open blood vessels will be there that can be get into easily. Actually, the barrier inside that, just like the skin is giving its barrier function from the microbes, the internal lining is giving a barrier function, but that is lost in this inflammatory bowel disease. That means that is called leaky gut, and all this gut is leaking and getting unnecessary things into the bloodstream. And where does it go? The first pass, that is going into the liver, directly going into the liver, and liver has to take all the burden out of this. So inflammatory bowel disease patients will be definitely having this fatty liver and problems. And also there is this autoimmune liver diseases that also has the connection with the gut. And this two types of autoimmune, one is this autoimmune hepatitis is there, and autoimmune cholangitis, that is the bile duct will be affected. And bile duct will be inflamed and fibrosed, and it will get blocked. And in modern medicine, actually, if the block is there, we'll try to put some stent or some mechanisms to dilate it and things like that. Actually, for that also, there's not much of medication. So in that, actually, what we have to do is to find out what is actually the problem with the gut. If the autoimmune diseases like this Crohn's disease or this ulcerative colitis or this liver autoimmune disease also, the basic problem will be lying in the gut, and there will be unnecessary things are getting into the liver, coming into the liver through the portal circulation, and that is actually the liver is trying to remove all these toxins, but it is unfortunately it is failing, and the inflammation is the damaging the liver cells itself or the liver duct, this bile duct itself, and we are going into problem. So we had to look into when the liver is actually a part of the digestive system itself. So if the liver is damaged, look into the digestive system also very closely.
So now we understand that earlier we were talking about those who are having a liver problem normally have multiple other diseases like diabetes, hypertension, and kidney disease and cardiovascular disease and all that. Now we understand that if you have a liver disease or a liver disorder, definitely the gut is also very much related. And when you are taking multiple medications for multiple diseases, not only the liver, but the gut is also very badly affected. So that is clear. So if it is like that, if a patient comes to you who is having multiple diseases and has liver disease and also a problem like you mentioned with the intestines and gut and all that, how do you see a treatment? Because can we stop all the medications together, or what is the way in which it is approached?
See, we had to find out what is actually creating problem. And so for we usually look into the food habits and the activity pattern, and whether how much of toxins going in, how much of toxins are there in the body, and what is the gut health, and what is the nutritional status, and different aspect. And then we will be approaching it in a very systematic way. And usually most of the medications can be stopped within a month, not simply stopping. Gradually it can be reduced into and taper off within a month. The diabetic medicine, if it is a type 2 diabetes, it can be stopped initially itself, and we'll be following it. The blood pressure sugar is maintained normally. So it is actually, it is very, if you know how to approach the clinical support, the patient is getting a very clear clinical support. It is very easy to reverse. Only thing the patient should have the mind or they should also understand why they are taking the medicine, why it is not getting effective. They may be taking medication for the 20-25 years, but the disease is not going. But it can be simply reversed and corrected within the medications can be returned within a month. It is very difficult for the patients to understand. That is the problem actually. And we had to, the people has to understand it. They had to grow into that level of medical and health education has to change. That is the most important. The awareness has to increase. The lifestyle disease, the medication is not the answer. Lifestyle correction is the answer. They have to understand it.
Thank you for watching this third episode. Here we saw liver disease and fatty liver and the complications and comorbidities associated with them. Additionally, we understood how when treating these other diseases can become a very big challenge, actually increasing the risk overall. In addition, we also found that there's a strong connection between the gut and the liver, and these are also affected when treating other disorders. Now, we also got a feeling about how clinically supported lifestyle correction can help in such a situation. In our next episode, we look at how clinically supported lifestyle correction has made changes in the way we approach treating such patients, and what is it that is in it for them to understand and adapt in their lives. Thank you. The informed patient is key to treatment success.